Hello, welcome to the weekly COVID-19 update brought to you by Southwest Montana Community Health Center and the Butte-Silver Health Department. Today, I am talking about masks and the proper wearing of those. I'm Karen Sullivan, the Public Health Officer for Butte-Silver, and my partner in crime.
I'm Serena Brewer, the Medical Director for the Southwest Montana Community Health Center.
Let's talk through the mask issue. I have here my favorite mask. I have probably 5 different masks. This one was given to me by Montana Tech. It has a little Montana Tech logo, and it's my favorite mask. It's very comfortable, and I think it's good looking as well because it has the Montana Tech logo on it. So I wanted to show that off. Dr. Brewer, let's talk through the mask issue. How do we do it right?
So we do it right by wearing our masks whenever we're outside of our home, when we're riding in cars with other people, when we're in businesses, when we're in school. And this is a hard one, I think, for school-age kids because they haven't necessarily had to wear masks all the time. A lot of us, as we go to work each day, have gotten used to having a mask on our face for most of the day, but our kids have not. And so as we head into school, this is going to be one of the things we know is hard for everybody, is to wear a mask for more hours of the day than not. When you are wearing a mask, you want to make sure that a mask, I'm going to use my favorite mask to demonstrate, a mask should completely cover the top of your nose, and a mask should completely go under your chin as well. So it doesn't count if it sits below your nose, and it doesn't count if it sits above your chin.
Wonderful. So public places would be things like grocery stores, convenience stores. I live in Uptown Butte. I live in a big apartment building, and all the general areas of that building are designated places where I have to wear my mask. And so when you're out and about in public places, are you seeing that people are generally complying and doing it right?
We have been seeing more and more mask wearers, but we do still see a lot of folks with the mask not quite on correctly. And so that's the important thing to understand, that to truly decrease the rate of COVID spread in the community, you need to have your nose and your chin covered to really decrease the respiratory droplets that you produce as you're talking or breathing or coughing or laughing.
A lot of masks I see, Dr. Brewer, are loosely worn with a lot of opportunity for, and I think probably people wear them that way so they can breathe better. But to me, if the mask isn't encompassing and close to your face, it might defeat the purpose.
It does, unfortunately, defeat the purpose. If there are open gaps, there's opportunity for respiratory droplets to escape and then be transmitted out into the air and potentially passed on to another person. It certainly feels much more comfortable to all of us to wear a loose-fitting mask. It's easier to breathe, it's easier to talk, but unfortunately, it really does not help us as far as decreasing the rate of transmission of the virus. So it is important to have a good fit on your face. To give you an example, when I am working, especially in the hospital setting, if I'm wearing what we call an N95 mask, I need to know that it's tight-fitting completely around my face, and I really shouldn't feel air escape at any point. And while we know that's unrealistic to ask the rest of the community to do that all the time, we use that as an example. So if you can easily slide your fingers in on the side of your mask, if you can do this on the bottom of your mask to pull your mask out to talk, those are all things that actually are counterproductive to what we would like to accomplish.
Dr. Brewer, we in public health talk to people all the time about washing their hands. And I read somewhere and am knowledgeable about the fact that prior to putting on a mask, it's a good idea to wash your hands with soap and water, and maybe do it for 20 seconds prior to putting on your mask. And then when you take it off, another good hand wash might be advisable.
Yes, definitely both. With putting on your mask and taking it off, we do recommend washing your hands. And then anytime in between, if you touch your face, you need to wash your hands. And what we're concerned about there is if you are an asymptomatic carrier of the virus and you have now touched your mask with respiratory droplets on it, you have that on your hands and you are a point of contact that can now spread that in other places. So we really want you, if you touch your face at all, if you have to scratch your nose, I understand, but then you need to get up and go wash your hands.
Wonderful, thank you. Another thing, I think people, when they're wearing a mask, have some comfort in that and may forget that the 6 feet of physical distancing might not have to be complied with. We advise that even though you're wearing a mask. Is that something you're in favor of as well?
For sure. So we know that wearing a mask does decrease the amount of droplets that you can produce pushing out into the space around you, but we also know that it can still happen even with a mask on. So the safest bet is to maintain that effective 6 feet of social distance.
Dr. Brewer, I noticed your favorite mask is washable. How important is it for people to wash often, when they're wearing their mask?
So we do encourage you to wash your masks regularly. I probably am a little bit obsessive. I wash my masks every day because I never know where I've been, or I carry enough masks that I can use one each day and then wash them at the end of the week. But at least once a week, washing your mask is a really good idea.
Wonderful. Anything else you can think of to tell our general public about mask wearing?
So some of you may have seen in the news that there were some studies on how effective masks were, and we were surprised to learn that the gaiter masks, which you can wear around your neck and pull up over your nose, have the potential to make things worse rather than better. It doesn't mean that we want you to stop wearing them. We just want you to be aware that it may not be as effective as other types of masks. The best masks are surgical masks if you have availability to them while you're working, in particular. When you're out and about in the community, if you're wearing a cloth mask, we encourage a type of mask that's 2 layers of cloth as opposed to a simple single layer. But the most important thing is wear a mask.
Wonderful. Well, breathe easy, Butte, and wear your mask, and I hope you find a fun one to wear. I saw a spider mask yesterday that was very fun. So I think people can get creative with this, and out of an uncomfortable situation, I think we can have fun. Thank you for joining our weekly message. Thank you to Southwest Montana Community Health Center for being a terrific partner in the age of COVID-19, and we wish you a very safe week.